Oncologist Dr. Leah Dietrich is here today from Gundersen Health System to talk to us about what some people perceive as an increase in the number of cancer cases. And being an oncologist, that means you're a cancer specialist. But why are people getting they feel like there are more cancer cases? Is that necessarily the facts?
Well, I think there's a couple of different reasons for that. The first is that cancer is, on average, a disease that's more likely to happen as people get older. And people are living longer these days. Also, the baby boomer generation is aging, and so there's more people in that age group where the incidence of cancer is the greatest. So although the absolute number of cancer cases might be higher, we've actually been seeing for decades that the cancer rate, the number per 1,000 people, is actually declining.
Okay, so that's a good thing. The other good news is there are lots of new ways to deal with cancer if you are diagnosed.
Right, and so we think one of the reasons that rates are declining, cancer death rates that is because we have better screening and more effective treatments. And we also have a lot of things that we know we can do to prevent cancer.
Okay, when it comes to those things, there's something called the QOPI, which is the Quality Oncology Practice Initiative. And to be certified, what does that mean for Gundersen Health System?
Right. We were actually one of the first practices in the nation to be certified in 2010, and we recently had our certification renewed. This is sort of a kudos for us in terms of an acknowledgement that we're providing quality care to our patients, but more importantly, it's also a way for us to measure ourselves against other places all around the country. So if there is something that we could improve, we can really target that area and work to make improvements.
Very good. Well, thanks so much for putting this into perspective. If you want to see more, you can always read the New York Times article about it as well. And thanks so much for joining us today, Dr. Dietrich.